October 15th is not the day Medicare changes plans. It is the day the annual window opens. Miss December 7th, and the full choice may wait until next year.
That is the deadline people remember backwards. October 15th opens the window. December 7th is the request deadline for a January 1st change.
And what you can do depends on where you start. An Advantage enrollee has a different January to March lane than someone in Original Medicare.
So do not begin with a commercial. Erica, begin with your current coverage, your doctors, your prescriptions, and the date the new coverage would begin.
If you move from Advantage to Original Medicare, Medicare.gov warns that you may need a separate drug plan and may want Medigap. Those are separate decisions, not automatic accessories.
Grace, the annual notice is the prompt, not the answer. Read the plan change, then check the doctors and drug list before you click anything.
Coming up, Professor Beaulieu separates the October window from the January window and shows the action each one actually permits. Which window matches your current coverage? Before we keep going, one small favor that actually moves the needle. If this is landing for you, tap like, then subscribe and turn on the bell so you do not miss the rest. 2 taps, completely free, and it pushes this in front of more people who need it. Professor Beaulieu, give us the clean split before somebody marks the wrong date.
The fall open enrollment window is October 15th through December 7th. It is the broad annual lane. You can change Advantage, drug coverage, or how you get Medicare depending on your current arrangement.
Now the narrower lane. Medicare Advantage open enrollment runs January 1st through March 31st, but Medicare.gov limits it to people already enrolled in an Advantage plan.
So an Original Medicare enrollee cannot use that January to March period as a general invitation to jump into Advantage. The starting coverage matters.
During the January to March period, an Advantage member can switch to another Advantage plan or return to Original Medicare and join a separate drug plan. The change generally starts the first of the month after the plan receives the request.
Lewis, what gets missed when prescriptions are the real reason for switching?
The drug list is not decoration. Check each medication, the pharmacy network, and the plan's rules before treating a lower premium as a win.
And if a move, lost coverage, Medicaid, or extra help triggered the change, you may be looking at a special enrollment period instead. Its timing depends on the event, so do not borrow the fall dates automatically.
That is the rule to carry. Current coverage first, window second, action third. Professor Beaulieu, thank you for keeping the calendar honest. Before you switch, write down the coverage you have today. Then list your doctors, prescriptions, pharmacies, and the places you expect to use care.
Use Medicare.gov's plan comparison tools to check the actual options for your area. A generic advertisement cannot tell you whether your specialist or drug is covered on the terms you need.
Erica, then ask, am I in the fall window, the January to March Advantage window, or a special enrollment period? Those are 3 different doors.
For a full election, Medicare.gov says the plan must get your request by December 7th, and the change takes effect January 1st of the next year. Do not confuse the day you submit with the day coverage starts.
Write the confirmation number, the plan name, the effective date, and the drug coverage answer in one place. That turns a deadline into a record.
If the window or your situation is unclear, call 1-800-MEDICARE or the plan and ask which enrollment period applies before you submit a change.
If this helped, like and subscribe, then save it for the fall and share it with the person who keeps confusing October 15th with December 7th. Which window matches your current coverage? Recheck the official Medicare page before you act, and take care.